Click subscribe and bell icon to get regular notifications.
On behalf of Yashoda College of Physiotherapy and Yashoda Institute of Physiotherapy, I, Principal Dr. Maunima from Yashoda College of Physiotherapy, take the immense pleasure to welcome our dignitaries, speakers, academicians, clinicians, and students for today's webinar on PT Career Beyond Horizons. We have with us on board Dr. A. Lingai Garu, Director, Medical Services, Yashoda Hospitals, Hyderabad, Dr. R. Chandrasekhar Garu, Dean, Yashoda Educational Institutions, Dr. Nagasuman, Academic Advisor for both the institutions, Dr. Mansa Swargam, Principal, Yashoda Institute of Physiotherapy, Dr. Rajesh Reddy, In charge, Chief Physiotherapist, Yashoda Hospital, Somajiguda, and our iconic speakers, Dr. Sunil Kumar and Dr. Pradeep Kumar today. It is important to understand that the employment landscape is changing swiftly. As conventional placements are upended, new jobs are emerging, and the pace of change is exponentially fast. In contrast to watching TEDx talks for motivation, which we further translate to our personal scenario, today we have with us our very own professionals, successful, established physio entrepreneurs from USA and Canada, to guide us on how to progress and achieve a successful career in physiotherapy. So now let me take the honor of inviting our chief guest, Dr. Lingai Garu, Director, Medical Services, Yashoda Hospitals, Hyderabad. Sir believes in building a strong healthcare personnel through academic and service collaborations. His wisdom has constantly directed all our educational initiatives at Yashoda Hospitals towards best standards and teaching practices. Sir, I request you to inaugurate today's webinar on PT Career Beyond Horizons with your valuable message.
Thank you, Monima. I welcome our today's speakers, Dr. Sunil Kumar from Canada and Dr. Pradeep Kumar from USA, and Maunima, Principal, Manasa, Principal, Dr. Chandrasekhar, Dean, Dr. Nagasuman, and Dr. Rajshekhar. The importance of the physiotherapy will become more, and after that, this research also started in physiotherapy. A lot of new equipments, techniques, methods have evolved. And at present, all of you know the importance of physiotherapy. In India, the foundation physiotherapy started in 1952. At that time, polio epidemic was there in India, and the first school started in 1953 in Mumbai. Now, at present, I think approximately 450 colleges are conducting courses. Yearly, 5,000 to 6,000 people are coming out, and now approximately 75,000 people, physiotherapists, are working in India, and a good number of people are also went abroad, and they are giving services to the patients all over the world. But still, we need more physiotherapists because it has grown up. A lot of subspecialties have come: orthopedic, cardiology, pulmonology, neuro, and sports. Different specialties have come. Even in the specialties, also different branches have come. So the demand for physiotherapy is very high. The World Health Organization has recommended 1:10,000, one physiotherapy per 10,000 population. But what I feel, it is a very it is not correct at present, because they have done it long back, but now a lot of physiotherapists are needed. I think all of us should write WHO physiotherapy section to rethink about the ratio. I think the ratio 1:10,000 is very, very less, and they have to increase it. Regarding physiotherapists, most of our physiotherapists are they are doing good job, good service to the patients, but lack in communication skills, confidence, and skills. So they have to improve their theoretical knowledge. They should have a good theoretical knowledge, very good practical skills, and communication skills also, so that they can confidently conduct physiotherapy services. They should talk to the consultants, clinicians, one-to-one. They should not be timid. They should not afraid. this confidence, it is essential to create this confidence in our people. All HODs of the physiotherapy all over the world, and principals and in charges, everybody, our seniors, they should motivate our people to do it. I entered into MBBS in 1968, I think 5 decades ago, half century. At that time, people used to think doctors are gods. But after 50 years, now you see patients are gods, not doctors are not. There is a sea change. Same thing happened in the physiotherapy also. Physiotherapy, a decade before ago, physiotherapists used to think that they are dependable on the clinicians. But now clinicians are thinking they are dependable on the physiotherapists. So this you have to keep in your mind to develop your skills, your program, your knowledge, update your knowledge, conduct a lot of programs, improve your communication skills. I think each and every one should do the publications, write articles, conduct CME programs, even in the places where you're working, 15 people are working in one place. Every day they should have one person should talk about one topic to update their knowledge, to improve their communication skills, so that every 15th day, one person, the same person will, in rotation, they will talk. It will improve their communication skills. I request all the in charges, HODs and principals to do it. Every person should talk definitely one topic every day. So that will improve the thing. A few things about our hospital. Yashoda Hospital in Hyderabad has 3 branches, 3 super specialty hospitals with 2,000 beds. And we are number 1, the largest healthcare provider in AP and Telangana, twin states. We have 7 cath labs, 6 linear accelerators for radiotherapy, and we have 4 MRIs, 6 CT scans, and each hospital is independent, 50 operation theaters, 2,000 beds. So we are the number 1, and we are going to start one more hospital, 4th hospital in high-tech city with 2,000 beds. So totally our beds will be 4,000 in coming years. In coming 1 year, maybe at the end of the 2021. With that, we will be the number 1, one of the number 1 best hospital, largest hospital in India also. So for physiotherapy also, we are giving a good 12,000 SFT place in that hospital. It will be one of the best physiotherapy thing. And Yashoda believes in quality. Our growth is based on quality service to the patients. We firmly believe that quality comes with academics. So in that process, we have started a lot of programs for the programs to improve the quality. We have started nursing colleges initially in 1997 onwards. We have each hospital have 1 college, 1 school. Totally, we have 3 college, 3 school nursing schools. Medically, we started DNB programs also. In all specialties, we have 300 DNB students to serve with patients. And we have a lot of other emergency courses, MEM, and we have IDCC critical care courses also with us. And even in paramedical courses are also there, radiology, lab, all those things. And we thought that even physiotherapy also now got very, very importance in the healthcare system. So we started 2 colleges in physiotherapy also. Now we are running 2 colleges. Maunima is and Manasa, they are heading the institutions. So my request to all of you, please, all the participants who are now participating in this webinar, each one should be like Dr. Sunil, like Dr. Pradeep. They should grow in that to that level, even beyond. Guru Shishul Kawal. So that is my request to all of you. And I am sure this program will update your knowledge as we have very good speakers from Canada and America. I think I thank speakers for spending time with this webinar. And I once again congratulate our team, physiotherapy team, Nagasumant, Dr. Chandrasekhar, Nagasumant, Maunima, Manasa, Dr. Rajshekhar, all our team. And I request them to conduct more and more these programs in the future also, because That is the best way of improving our knowledge, skills, and with that we can provide good service to patients.
Sure.
My best wishes to all the participants in this program and wish a grand success in their future professional careers. Thank you.
Thank you, sir. Thank you for your kind presence and motivating words. As a growing individual, there is never a finite amount of knowledge to be acquired. In fact, there is no set limit. As each second passes by, we learn something new. To read and in fact listen intently to what one has to say regarding his or her own life, their own diverse experiences, and definitely their own perception on a set of views. There is no secret to success, just a lots of little tips and experiences that work. Now I take the honor of introducing our first speaker for today's session, Dr. Pradeep Kumar Yamsani. He holds a Doctor of Physical Therapy degree. He is a compassionate clinician with more than 10 years of experience in post-acute rehab and long-term care settings. He is the Executive Director and Licensed Nursing Facility Administrator with exceptional Department of Health Survey history, including 2 deficiency-free health surveys in the past 3 years. He is a Board of Director and General Secretary of National Physical Therapy Association of United States, a non-profit professional organization working to provide physical therapy services access to all Americans, especially in rural areas. He is also a Texas Healthcare Association Business Advisory Board member. His milestones include Bachelor's of Physiotherapy from Dr. NTI University of Health Sciences, Vijayawada in 2005, and he holds a Doctor's of Physical Therapy in January 2009, University of New York, Stony Brook, New York. His professional experience includes, as a physiotherapist, he has been working from Jan 2009 to December 2011, and he took up as Director of Rehab from 2011 December to Jan 2013 at Morningside Manor Nursing Home and Assisted Living. From Jan 2013 through May 2016, he has taken up as Director of Rehab at Paramount Rehabilitation and Healthcare Center. And from May 2016 through October 2017, he is the Director of Rehabilitation. And from October 2017, he has taken as Executive Director at Legends Oak Healthcare and Rehabilitation Center. His responsibilities include, he is an administrator responsible for 126-bed skilled nursing facility with 14 facility managers or leaders and 120 employees. So we have a leader who leads the leaders. And he's also responsible for measuring and assessing clinical business activities and care coordination on day-to-day operations of the facility. So now I request Dr. Pradeep Kumar to enlighten us on career prospects and scope of growth and some insight on NPTE exams for PT career in USA. So please.
And first of all, thank you everyone. And I really, I feel humble, honored to be a part of today's session. First of all, I would like to convey my gratitudes to Dr. Lingai sir. And I mean, you know, your speech is amazing, sir. You know, it inspires us, and you will be a backbone, you know, for the Yashoda Institutes as well as physical therapy profession. You know, this is one of my best speech I heard from a senior like you. And I congratulate Yashoda Institute for the new campus. And this shows how much support and how much love and affection the profession is going to get from you guys. So I really applaud, and I'm very thankful to be a part of this session. And thank you, Dr. Monima Garu. And I just want to say special thanks to Dr. Suman sir, and he is my guru. And you well said, sir, Dr. Lingai sir, and he's our guide and guru. And thank you for giving me this opportunity, sir. So I would like to share again. There is a big speech about my introduction. I felt that, but you know, I'm kind of a regular, normal physical therapist working in United States. So I want to share my thoughts about profession, and I want to help my fellow PTs back home, you know, in whatever the way. So I want to make this session more productive, and I want to divide this session into 2 components. The first component is going to be talking about physical therapy profession in United States in a brief. And the second component is going to be how to become a licensed physical therapist in United States. So I divided into 2 sessions, and I would like to share the screen now. I'm very passionate about speaking about my own profession. Just to add to that, and today's speech by Dr. Lingay sir, again, it stole my heart. So thank you, sir. That is a really big boost. So first of all, I just want to, again, I'm an executive director at Legend Oak South Healthcare. It's a rehabilitation center. It's a post-acute care. We have 126 beds facility, and we have around 100 plus employees. So we have a department, nursing department, physical therapy, occupational therapy, speech therapy, and we have 4 doctors, and we have a medical director, and overall we have 100 plus employees who serve 126 residents in that. And I am a founding member of a National Physical Therapy Association. I want to just give a brief out about this association. So it's a non-profit organization. We, the immigrant PTs, the foreign educated PTs, we formed this organization recently. The whole idea of this organization is, to voice immigrant PTs in United States. So this is going to be a platform for all physical therapists across the United States, the foreign educated PTs, to voice their needs, such as their immigration issues or license issues or day-to-day educational updates. That is about the NAPTAS, that is National Physical Therapy Association. So I want to jump onto the component 1, what we discussed, that is going to be the physical therapy profession in United States. Again, going back to Dr. Lingay sir quote, as sir mentioned, there are 75,000 PTs right now in India. And sir, I 100% agree, we need more than that. We need more than that to serve our country. And I just want to share some numbers from the US Bureau of Statistics. So as per the APTA, American Physical Therapy Association, and US Bureau of Labor Statistics, the employment of physical therapists is expected to grow by 22% from 2018 to 2028, much faster than all average occupations. So the physical therapist is a fast growing demand occupation. That's the reason the government of United States recognized the need of physical therapists, and they included the physical therapy profession into a category called Schedule A. So they made a provision to encourage foreign PTs to come to United States. They want to ease off the requirements as well as the restrictions. So one of the restrictions is going to be the labor certification. So the Schedule A removes the restriction to make it easy for foreign PTs to come into United States. That is a brief about Schedule A. And if you guys see the demand, all the numbers in thousands, right now, the physical therapy supply and demand in United States. On the left-hand side, you can see the numbers in thousands, and the right-hand side, in the bottom, you see the years. By 2025, this is the recent one, but there are a couple of other surveys says up to 30% demand in for the physical therapy profession. And one of the major reason is going to be the baby boomers. Baby boomers are the aging population. United States is going to face the aging population within 10 years, the coming 10 years. So we need more healthcare professions to take care of those aging professions. And there is if you see the second part of this slide is the facility setting and the percentage wise. These are the areas where physical therapists work in United States, like acute care hospital setting, the hospital-based outpatient facility clinics, private outpatient offices, skilled nursing facility, long-term care, and home health, school system, and academic institutions like post-secondary and health and wellness facilities, research centers, industry, and inpatient rehab facilities. And there are some other areas where physical therapists practice in Example, workmen's compensation, insurance companies. They work as an advisors, and they kind of calculate the demand and the requirements for the health. And moving on to the same topic again, job prospects in United States. About around 17,000 openings for physical therapists are projected each year on average over the decade. So this is again gives the numbers, how much requirement of physical therapists are needed in United States. As you all know, India is 4 times more than United States population. So what we see here, and what Dr. Lingesar said about the numbers, we need 4 times more. So based on the forthcoming utility. So the the growing demand. There is a small graph where it shows the physician demand and physical therapist demand. Again, going back, the previously, it's more of a physician referral dependent, but it is slowly shifting where it's going to be a mutual, where medical as well as the therapy, they're kind of working as an interdisciplinary team. So this is a brief about the professional need in United States, and I just want to tell all the participants and students and the fellow PTs that I know a lot of people, there are United States aspirants. So I just want to give a word to you guys, say that there are opportunities, and United States is a land of opportunities. So, and there again, going back to the entrepreneurs. So I have seen in my 12 years physical therapy professional career, there are a lot of entrepreneurs. They are working in a hospital settings, home health settings, and assisted living, congregational settings, and there are like some technical field. So the basics, what I feel is, again, going back to Dr. Lingesar said, we need communication skills, we need leadership skills, we need the people to think out of the box, focus on the research, focus on the evidence-based practice. So these are the things which we can talk on, but I just want to move on to the some of the other basic requirements to practice in United States. You all know we have 50 states in United States, and each state has a special requirement to practice as a physical therapist. So every state holds a license board, and that license board issues a license to practice. So, and in order to become a PT in United States, the people here, they have to do a 10+2, that's we call intermediate in India, and they have to have a bachelor's degree, and then the entry level is a DPT, that is a doctor of physical therapy. This is for the people in United States. And the people from India who has a bachelor's degree in India, they can go through the steps what I'm going to discuss right now. So we are going to move to the second component, that is going to be physical therapy profession in United States. And how to become, steps wise. Let me add something on these specialties. In US, we have, these are the specialty areas where physical therapists are specialized: cardiovascular and pulmonary, clinical electrophysiologists, geriatric certified specialists, neurology, orthopedics, pediatrics, sports, and women's health. These are the specialties where physical therapists can get a board certified specialist. So now the interesting part, and most of the people want to know the steps to become a licensed physical therapist in United States. So before we go to this section, I want to go with a few of the credential agencies. One is called FCCPT, and the CGNFS, FSBPT, and NPTE, TOEFL, visa. So again, the basics is, once we have a bachelor's degree or a master's degree in physical therapy from India or any other country, they have to go through these credential agencies to get their credential evaluation. So the Foreign Credential Commission of Physical Therapy is the main institute which does all the credential evaluation for foreign educated physical therapists. And FSBPT is a Federation of State Boards of Physical Therapy. This is kind of a national head which monitor all the licensing states and licensing requirements. And NPTE is it's a license exam, National Physical Therapy Examination. And even though you graduate as a physical therapist, you need to pass this license exam in order to practice as a physical therapist. That is NPTE. That is one exam. Once we pass, then we need to apply to the state board. That's where you can practice. And TOEFL. You all know about the TOEFL. TOEFL is English speaking skills and communication skills that will test whether a person is able to communicate and comprehend the English. And the visa part, there are several types of visas. One is F1, that is called student visa, B1, B2, that is a visitor visa, H1B, that is worker visa, H4, that is dependent working visa, and GC is the green card. So we are going to use these words. That's the reason I want to make you guys familiar when we are using these words. So going back to the steps, the first step in becoming a licensed physical therapist is credential evaluation. As I mentioned, any physical therapist who's graduated from India or any other country want to come to United States, first of all, they need to verify their credentials. I mean, whether they are equivalent to the United States degree. The first step is going to be a credential evaluation. Again, I just want to mention these steps varies from person to person, but I'm trying to give a collectively an umbrella type of overview how to get the evaluation part. So the credential evaluation is again, the first step in the credential evaluation is you need to select a state, which state you're going to go out of the 50 states in US. So whether it can be a California or Texas, New York, New Jersey, whatever the state. The first step is you need to pick the state you want to go. And the next step is FCCPT ECR evaluation. That is called as a educational credential review. It's called as a credential evaluation. That's the first step. What does FCCPT do? So they take your BPT or MPT credentials, like your coursework tool and your syllabus, everything, and they compare to the United States educational level. So they compare and they evaluate and they say, okay, this guy or this person will be equivalent to the United States degree. That is what FCCPT does. So, and in that, they use a tool called coursework tool to evaluate your credentials. One tool is called as the CWT4, CWT5, and CWT6. This varies based on the year of graduation. So if you graduated from 1998 to 2009, they will use the CWT4 tool. If you graduate from 2010 to 2017, they use the tool CWT5. And 2017 to present, they use CWT6. So this is kind of a tool where they measure your credits, like how many credit hours you have in anatomy, physiology, the physical therapy subjects, as well as other general credits. So the evaluation tool is a standard. It's a mandated for the credential evaluation. And then the second portion for the evaluation is the visa screen certificate. We can discuss this visa screen certificate later, but this evaluation is the first step to get the license in United States. And there is something called, I want to mention on the New York State. The first step when we said select a state, so a lot of people have a question, hey, I did my BPT, can I come to United States on my BPT? Can I apply for license with my BPT? The answer is yes. You can apply for the credential evaluation. You can apply for the licensure with your BPT, but there are other steps you need to meet to fulfill your complete, the license requirement. So there is a different step for the New York State. The New York State also goes with the New York State Verification Services, FCCPT, and also CGNFS. That's the reason we were discussing about the FCCPT and CGNFS initially. And then the second thing is the New York State is unique. They have their own credential evaluation process. So they do their own credential evaluation. So once we done with the credential evaluation, and then we go with the second step, that is a state board registration. So you have a bachelor's or master's degrees in India. So you went to FCCPT, you applied for credential evaluation, you finished your credential evaluation, you got to know that your credits are matching to the United States education. That is the first step, you completed that. And then you go to the second step. That is, when you pick the state, like for example, you pick a Texas. So the second step, you need to go to the Texas board and apply that you want to become a licensed therapist in the Texas state. And that can be done in two ways. One is FSBPT, that is the Federation of Board of Physical Therapy. There is a website, I'll share the link, or the state board. So in that, again, there are 3 steps. The first step is alternative identification number. And that is a identification number where, like social security number. If you are currently in United States, they issue a social security number based on your visa. If not, they issue an alternative identification number. And the second step is, filling the application. So with the state board, you need to pay an application fee anywhere between $100 to $200. Some states have up to $300. Once you fill the application, they will communicate with FSBPT and also communicate with your credential evaluation from the FCCPT. They communicate once they check that this person meet all the criteria, and they will say, yes, you meet this state's requirement. And some states have something called jurisprudency exam. It's a very small open book exam that includes the policies and procedures for those certain states. So this is the second step, guys. Once the state says yes, this guy is eligible to sit for the exam, we go with the third step. This is a final step, that is NPT exam. So we have to register for the exam via FSBPT. That is the website where you go, you finished your credential evaluation, your state is done, your state gave okay, and then you finally go to the NPT exam. And then once you register in FSBPT, they will issue a letter called ATT, that is called as Authorization to Test letter. And once you get the letter, you need to go to the Prometric Center and you can schedule an exam. So these are the steps. I made it very simple to understand the 3 steps. Now I will go into the practical. I'll take an example, an individual with a BPT degree and in India, an individual in America. So first, let's go with the Indian graduates. So the one who has a bachelor's degree in India. So right now, the bachelor's degree has some limitations. You cannot apply in all 50 states. There are only few states they are accepting the bachelor's degree credits. So on an average, we get around 110 to 120 professional credits, overall credits. So not all states are accepting BPT. So going back, as I mentioned, I want to talk about the visa screen right here on the first step. So the visa screen, credential evaluation, state application, and exam is one part, and visa screen is another part. In order to get a visa screen, you need to have a master's degree to apply for the visa screen. So that is the reason I said a bachelor's degree has a lot of limitations to practice in US. So there are options. Option number one, you can do master's in India and you can apply with all these steps. And one important point I want to mention is a TOEFL. It is mandatory to have a TOEFL, and that's a total score of 89 and the speaking of 26. That is kind of most of the states, they require the TOEFL requirement. So those are the requirements for the licensure evaluation and credential evaluation part. So a person from United States, let's say a foreign educated with a BPT degree who came to United States on a master's degree, right? They can apply again. They have to go through the same process, but if they have a master's degree from the United States, they can apply pretty much most of all the states, and they can get the visa screen. One of the visa screen requirement is a master's degree. This is kind of an overall, in a brief, how to get a license in United States. Okay, guys, and there are some resources, as I mentioned, FCCPT website, CGNFS website, FSBPT, and there is something called FACS PT. If you see the fourth one, the FACS PT is a non-profit organization. Now I'm not an expert in immigration part. I'm not an expert in the credential evaluation part, and these people are experts. They are very professional. If you have any question, if you are a US aspirant, if you want to apply for US, so you can reach out to these guys, Fax PT, and what they do is they will talk to you one-on-one. They will do on a telephone interview type. They will charge a nominal charge for that, but they will explain you, they will educate you more professionally how to apply United States license. And then there is another thing called NPTE Study Buddy, and this is more of the examination information, how and what type of examination you have to go through in United States. This one, NPT Study Buddy, they also guide Canada licensure. They also guide Dubai licensure. So they help with Canada, US, and Dubai. So these are the kind of a brief outlook. And I just want to mention a few things about the profession in general. And I know Linge sir mentioned a lot of good stuff. And I want to give some examples in United States. As a profession, physical therapy is a very noble profession. And if you see, we are the only profession, I think, we spend more time with our clients, up to 30 to 40 minutes per session. So what we do is, again, we are hands-on. And what I think is we as a profession, what we are lacking is, one is communication. So because if you see a physician, they may spend up to 10 to 15 minutes or less than 10 to 15 minutes, but we are going to spend a lot of time with the clients. So the communication is going to be a primary thing, how we can efficiently convey our message, how we can able to understand their needs. So that is going to be a primary thing for everyone. As a PT, we need to be very proficient in communication wise. And then we can discuss a lot, and we want to take some question and answers. Anything on the credential process or PT profession in US?
There is one question. What is the status of visas and clearance after the pandemic struck? Is there any influence of the pandemic on the...
That's a good question a lot of people ask. And one thing I want to mention is, I think this pandemic situation gave a reality how important the PT profession is. So for the COVID recovery or COVID rehabilitation, the PT profession is so important. And here in United States right now, we are working on a bill called Healthcare Workers Act. And we are asking the Congress to add physical therapists into that bill. That's where our organization, NAPTIS, is working on it. Guys, as I said, this pandemic is a short period of time. And if you see the projections with the baby boomers and the requirement in United States, these numbers are very low numbers. But there is a huge need, there is a huge demand for physical therapists in United States.
When we apply for the evaluations and credentials, do they consider the IAP membership as a mandatory requirement? is one of the questions.
No, we don't need a IAP membership. And again, so we do not have I think a council right now. IAP membership is not required to get a licensure in United States.
And is the procedure same to apply for career options post PG and UG from a bachelor's in India?
Yes, if you have a bachelor's, master's, PhD, any degree out of United States, you have to go through these steps. You have to go for the evaluation. You have to get the visa screen certificate. You have to come. And one point I want to mention is the last and the NPT exam. The exam has to be given in United States. So yeah, you have to go through all these steps, no matter what level of degree you have.
Many of them have a confusion of TOEFL and IELTS. So I think, Pradeep, we need to give them a clarity that IELTS is not required to enter US. So I think it's better you give a talk on it.
So I wanted to make it clear. I know this is a common question a lot of people ask, whether I have to go to IELTS or TOEFL. And I say IELTS is not at all accepted in any of the credential evaluation process in United States. There are few colleges they may consider when you are trying to come on on a student visa for education. But please do not waste your time. If you are coming to United, you are planning for US on IELTS. Just focus on the TOEFL. And the important thing in the TOEFL is speaking. You need to have at least 26. That is one of the criteria.
And can we have a rough idea about the finance resources that are needed to plan for masters?
Okay, so I'll give a rough idea. Again, it depends upon what type of masters you're looking. So if you're a bachelor's degree and you want to come to United States on a master's for physical therapy or a DPT, so I'll give my example. So where I graduated in India with a bachelor's degree, and I came to US on a master's in gerontology services. Gerontology is a study of elder people, old people. So it costed us around 16,000 US dollars. So it varies depending upon what type of course you're looking. If it is a 1 year's master's program or a 2 years master's program or a DPT. I will give a range anywhere between 15,000 US dollars to 40,000 US dollars, depending upon the university, depending upon the course, and depending upon the location, the cost of living.
There is one query asking, is it ideal for us to pursue our master's here and then plan for a DPT abroad, or do we directly plan post PPT for a DPT program in US? Which one would work in terms of both finances and the time?
If you are really planning to come to US, and I say that you have to plan a DPT program in US, that will help you financially as well as that will help you the requirements. Just to give you an idea of the DPT wise, Doctor of Physical Therapy, now APTA, American Physical Therapy Association, and the credential, the part of the physical therapy, they are going to request every individual to be having a entry level or a minimum of Doctor of Physical Therapy. So I suggest to have a DPT or a TDPT in US.
There is one question, Pradeep, asking what are those loopholes or lacunae for a graduate from India where they find it difficult to clear NPT? What are the areas of focus which are neglected in UG curriculum here, which they find it very difficult to get through the NPT?
I can tell in two aspects on this: NPT as an exam and credential evaluation, right? So when a person is a BPT, so in order to get that eligibility to sit for the NPT exam, again, you have to pick a state where they accept your BPT. That is one part. There is some restrictions for the other state. But when it comes to the NPT as an exam, and that's a reason you need to have a master's degree in India that will help you a little bit more expertise to sit for the NPT exam. So NPT has a lot of components like assessment, differential diagnosis, evidence-based, the practice components. And there are other components in the NPT exam, and that is a standard. Again, I think in our BPT curriculum, probably at the entry level, we need to add few more. But I think the master's program in India, pretty much it covers the requirement to be addressed in NPT. But to be specifics, again, you have to look into the NPTE assessment. Like, they have a components, you can look into it, and you can go and find it out in FSBPT website. They have a clear explanation about the syllabus and what are the components they address in NPT exam.
Pradeep, can you discuss a little on GRE examinations relevance for the credential evaluations?
Okay, so GRE, for the credential evaluation, you don't need a GRE. So that is completely different. Credential evaluation is only for your educational credentials. So just to compare your Indian degree to the US degree. But I encourage people to go for the GRE if you are going to apply for a master's degree in US. So a lot of people, they think that, okay, we don't need to have a GRE, but most of the universities, one of the requirement is GRE score. And there are a lot of scholarship opportunities. If in order to save money, you can go give a GRE and get a good score. And I've seen a lot of people who did a completely free education with a GRE score. But that will be a big helpful. There is no need to worry of GRE for credential, but for the masters, yes.
I think we are almost done with the queries, Pradeep. I think you covered most of there are questions, but I think most of the questions are answered in your talk itself. There are a few questions, and I think we have covered most of them. So now, finally, I would like to ask you to wind up by giving your message for the young budding aspirants.
Okay, guys. So again, I want to take my example. So I graduated from the Hyderabad college, like Durgabai Deshmukh Hospital and Research Center. And if I can do it, you guys can do it. I just want to say this. And the last couple of points I want to mention, guys, look at big picture. Don't look just now. A lot of PTs, when I was a PT2, when I graduated, I was thinking, okay, this is physical therapy, but think out of the box. So I tell a lot of people saying that toolkit, right? So in the toolkit, what are the tools you're having? One of the examples I say, your communication skills, your leadership skills, your assessment skills. And I say, develop your tools. No matter what you're planning to stay in India or abroad, if you have a good toolkit with you, you can succeed anywhere else. So if you have that strong hold on those tools, you can achieve anything. And I'll give some examples, guys. In my own town right here, San Antonio, Texas, I see a person called, her name is Dr. Mona Talukdar. She's a physical therapist. She graduated from one of the Tamil Nadu universities, and she's one of the reputed owners for assisted living. She owns 3 assisted livings. She owns a home health. She owns a hospice company, and recently she started a visiting physician practitioner company. So I can name a lot of people who are PT graduates from India. And I can just continue saying this, but again, as I said, PT is a very noble profession, and develop a lot of the tools, as I mentioned. Learn about the technology. Now everything is going to be technology. So yes, I'm a PT student, but why should I learn the technology? But the more you learn, that will help you in your practice and in your future.
Thank you, Pradeep. That has been very inspiring message. We express our deep gratitude for your valuable time. We heartily appreciate your contribution for today's webinar. Thank you so much, Pradeep.
Thank you, everyone. Thank you.
Here we have with us today Dr. Sunil Kumar Kommanuvancha, Manvada. Let me introduce today. God-given hands are better than man-made machines. This is a statement to many, but there is one man who made it as a slogan of his physiotherapy career and proved it correct many a times during the last 20 years of his work in the field of physiotherapy. The man who needs no introduction. Many of us are already familiar with Sir as Manual Therapy Sunil Sir. Uh, Sir, you are known to almost everybody, I think, in the both the Telangana states here, the Telugu speaking states here. So before he relocated to Canada, Sir was very much familiar with all the institutes in India because he has conducted many workshops on manual therapy. So, Sir is a graduate and postgraduate from prestigious Manipal University. Dr. Sunil has specialized in orthopedics, physiotherapy, and manual therapy. After completing bachelor's in physiotherapy in 1999 and master's in 2002, Sir has joined as lecturer in Kasturba Medical College, Mangalore. From 2003 to 2005, he took over as in-charge HOD of physiotherapy at Sikkim Manipal Institute of Medical Services. In 2005, Sir has taken up as principal of Swatantra Institute of Physiotherapy and Rehabilitation, Rajahmundry, a postgraduate institute under Dr. NTR University of Health Sciences. As an academician, he has rendered many valuable services to Dr. NTR University of Health Sciences as an academic senate member, Board of Studies chairperson, Board of Examinations member, to name a few. He has conducted many workshops on manual therapy during his stay in India from 2003 to 2009. Apart from all the above, he was also a guide for many postgraduate research projects and medical classifier. He was a physiotherapist for 5th Para-Olympic competitions held at Bangalore, sports physiotherapist for 37th National Athletic competitions held in Chennai, and so on. In 2009, he migrated to Canada, and in 2011, Sir established Canadian Advanced Physiotherapy Incorporation, through which he is offering physiotherapy services to many with neuromusculoskeletal problems. He is now the chief physiotherapist at Mississauga Physiotherapy Clinic, a multidisciplinary rehab center located in Mississauga, Canada. There is no end to the list of his achievements. His success story continues to inspire us. We are fortunate to have Dr. Sunil. He accepted to be the guest speaker for today's session on Career Beyond Horizons. Now I request Dr. Sunil Kumar to share his success story and guide the participants on how to accomplish successful PT career in Canada. So please.
Thank you so much, Monima, for the good words about me. That really puts back me into the track that what achieved is very less, what need to be achieved is much more. It's a great occasion to be here on this platform. I already see here there are about 600 participants on this webinar. It's amazing. I congratulate the organizers, for having hosted such a beautiful webinar. And I congratulate each participant who is there on this webinar, because that shows the enthusiasm that they have towards the profession. They want to do more in the profession. That's very clear with this participation number, actually. And a lot of things that I was not clear about the United States procedures. Pradeep had very well cited all those. And I'm sure that there's a lot of people along with me have got now the clarity about a procedure, how to approach if somebody is seeking United States license. In fact, I was just noticing when Pradeep was presenting in the participants list, I was surprised to see some of the cardiologists who have been there. One of my a cousin of mine, and he's a renowned cardiologist from Warangal, is closely watching this webinar. Yes, it's such an amazing thing. Dr. Srinivas is a cardiologist from Warangal who is also a participant in this webinar. Yes, Dr. Srinivas Garu, thank you so much for being there. It's an inspiration to see a DM cardiologist to be there on this particular webinar.
For more than 2 hours now.
Yeah, exactly. That's right, Monima. It's an achievement for us that he is there on this webinar, actually. I have a little knowledge about the background of this Yashoda and how this came up by institutions and all that. We have to definitely acknowledge the amount of efforts our Dean, Dr. Chandrasekhar sir, has put into bringing these two institutions alive. The physiotherapy colleges that have come into existence under this great banner of Yashoda is definitely the hard work and the support that has been rendered by our dynamic Dean, Dr. Chandrasekhar. Thank you so much, sir, for being supportive on that occasion too. And there are some more questions, the participants were posting. I was just trying to, because Pradeep was handling the entire session. So I was just trying to peep into the questions and answers so that at least, we'll have some clarity on it. Now, moving on to about Canada part of it. Entering to Canada is much more easier than the United States. There's no doubt about that. So about the exam part of it, it's a little bit challenging because in United States, you only have a theory exam. You only give a written component exam and you will clear the exam and you can become a licensed physiotherapist. But in Canada, you cannot be a registered physiotherapist until you clear your written component of the examination, as well as there's going to be a clinical component of the exam. So that is a little bit hurdle. But, overall, definitely a better place. Now, let's not waste much time. Already we are, into it. So let's start with my presentation also. And, I'm just going to share the screen here. I hope we don't have any system glitches here. As we see this, today's topic for the webinar, Physiotherapy Career Beyond Horizons. Now here, it's a guidance to achieve successful physiotherapy career. Let's emphasize on this particular aspect. Guidance to achieve successful physiotherapy career conducted in coordination with, in Yashoda Hospitals and Yashoda Institute and the College of Physiotherapy. Now, guidance to achieve successful physiotherapy career. Successful physiotherapy career. For successful physiotherapy career, my dear participants, you need not go beyond the horizons. There is no way, there is no necessity for you to go beyond where you are. If you have good skill set, you can achieve a very, very successful career from where you are. I may be sounding very, very, old fashioned, or I may be sounding, what, Sunil is talking and all that. Just on a small note, I hope these participants who are there right now, they are all the physiotherapy students or already passed out physiotherapy students, and also some of the people who are already into the practice. And also some maybe there who are the parents who are wanting to join their children into the physiotherapy course. First, I'll address people who are planning to join their children into the physiotherapy course. If somebody has got a mindset that they want to join the son or a daughter into the physiotherapy course, please do not have any second thought about it. Because if there are any other courses that are going to be joined after the +2 or the 12th standard, your child is going to have to be dependent on many things for a successful career. But if he is doing a physiotherapy course and if he has got good skills, he is independent. Wherever he goes, he is going to be successful. He can be in Hyderabad and he can be successful. He can be in Dilshuk Nagar, he can be successful. He can be in Mangalore, he can be successful. He can be in Shimoga, he can be, but wherever he is, he can be successful. So the other courses are institution dependent. If somebody is doing a biology course, anatomy course, or any other physiology courses, or as a biotechnology course, or biochemistry, microbiology, all these courses are institution dependent. But when it comes to the physiotherapy part of it, it is a completely independent course. And even when it comes to a gender pickup, whether my daughter can join this course and do it or not, definitely it is very, very useful even for a female to pursue the course of physiotherapy. We see here the live examples of successful people like Maunima, and Manasa, who are the principals of those two institutions. And they haven't crossed the horizons. They are there. They are established there and they are doing well. And just on a very small, subtle note, I would like to mention one thing. Pradeep was mentioning to, in the webinar that he studied from Durgabai Deshmukh in Hyderabad, where Sumant was working and Nagaraj was working. I just want to quote one thing, like Sumant is my first batch postgraduate student after completing. And today where he has gone, we have seen it live. And in this particular webinar participation, there are so many others who are there. I was just scanning through the participants list, people who are all across in 2 different states who are very successful. The principals of various institutions are there. On the counter, on the panel, we have Rajesh Reddy, who is there, who is just my junior, who is there, who has got a very successful career and all that. So what I'm just trying to tell you is that a successful career in physiotherapy can be there with good skill sets. We need to be focused in what we are doing. If we have very good knowledge about what we are doing, the basics of anatomy, physiology, biochemistry, if students are there, I want you to understand these. And whoever is practicing also, I want you to understand it. I just want to quote only one example before I jump into how to come to Canada or how to successfully have a career and all that. There was one patient who came to me with a lot of problem in the lower back, wherein he went for an MRI, everything, nothing helped. Now he was complaining of pain in the lower back on the iliac crest level, and no findings of MRI have shown any problem. But because of a involvement in the postgraduate teaching and an institution like Manipal, as Lingesh was mentioning that we need to have a lot of discussions about our subjects and all that. One of the postgraduate presentations, we had something called on a cluneal nerve, which comes from the thoracolumbar junction, and the nerve directly goes into the iliac crest. So if somebody is treating the patient in the thoracolumbar junction, they had all the relief in the pain in the sacroiliac area or lumbosacral area. So what I'm trying to tell you here is that if you have good skill set, you are the best physiotherapist. And you can surpass a lot of people who are there. Today, we are commanding the respect. The patients are calling us doctors. That comes with the professional achievement. There were a lot of questions which were posted in the question answers when Pradeep was talking about why do we not getting the doctor degree, all those things. My dear friends, we do not need the doctor in front of our name. That has to come automatically from the patient's heart to call us as doctors when you do an excellent service on them. Without, even when you tell them not to call the doctor, because in Canada, physiotherapists are not doctors. But the patients start calling us doctors when they see a very good improvement in themselves. So, what I'm just trying to tell you at the final thing is that whatever that you are doing at this point of time, how should I become a good physiotherapist? A first-year student, if he's asking me a question, read your anatomy well, understand your biomechanics well, understand your biochemistry well, understand your physiology well. You are a very good physiotherapist. Same wise as the person progresses into the career, just stick to the basics and learn and encapsulate your knowledge so that you become the best physiotherapist and you can serve the community. Lingesh sir was mentioning one more thing, that 10,000 people, there is one physiotherapist. I'll tell you, we need one physiotherapist for at least 500 people. 500 people, if they are there in the community, we need one physiotherapist to serve that 500 people. And 500 people, there will be one or the other problem or the ailment that you will be always busy. Till this humanity survives on this earth, this career is not going to have a downfall. There is no doubt about that. So without any second thought, I know I was talking to recently Maunima. She was mentioning to me that there was a student who got admission into BDS and they dropped down the BDS and they came into management quota and took the physiotherapy course in one of the colleges. I will tell you one thing, hats off to that student who has taken it, because I will add to it. we as physiotherapists do a complete study about the entire human body, not restricting ourselves to part of the body. And today, in my own family, at least, people who have got ailments of other, systems. Somebody who's got a neck pain contacts me. Somebody has got a heel pain contacts me. Somebody has got a shoulder pain contacts me. Somebody has got problems with breathing. Sumant was just recently presenting the breathing patterns in COVID patients. So lungs has got a physiotherapy, brain has got physiotherapy. I had an opportunity to come to United States to present one presentation on the zinc ionization in controlling the infections of the eye in one of the ophthalmology conference. One of my teachers from Manipal happened to be a dean in AIMST in Malaysia. So when she came, she invited me for a small presentation in Malaysia, and I was doing it for the ophthalmologist. So even we have the care in ophthalmology, we have the care in dermatology, the ultraviolet A and all that. So, such a vast field. So this particular message is for the students who want to become physiotherapists or who are already pursuing your career as physiotherapy. Don't get disappointed that you are in the wrong course, my friends. You're all in the right track. And as Pradeep was mentioning to you, definitely you need to upgrade yourself into a master's level before leaving the home country. Or if you really want to have a good, strong foundation and career, after the BPT, you can even start looking for the DPT programs, that is the doctorate in physical therapy and all that, and then you can come over. Now, having said all these things, I just want to go into what the Canada has got to offer you guys. As I was mentioning to me, in Canada, physiotherapy is a regulated profession. Nobody can use just on a very subtle note, I would like to mention this. For 10 years, I had a beautiful career in India. I was a principal of Swatantra Institute of Physiotherapy and Rehabilitation. Before I go forward, because we were just talking about a general profession and all that, let me take this a wonderful opportunity because of the kind of participation that this webinar has got. From this platform, I would like to thank all the managements of the private institutions that are offering the physiotherapy courses, because of whom we are all here. If Pradeep is in the United States, it's because of one of the private institutions that has offered him a program. If I am here, a private institution, if somebody is there, so the private institution managements and the directors who have, rendering so much of support for physiotherapy to grow in the 2 states of Andhra Pradesh, or as a matter of fact, all across the country, their efforts cannot be forgotten at this point of time in making so many it's kind of a factory of physiotherapists that's coming out. Now, with that particular thank you note to all the directors of different private institution managements, I just want to go forward. You need to have a license to practice in physiotherapy in Canada, but you do not need any license to practice as assistant physiotherapists. Now, what do I mean by that? I just want to show you the regulation here. If we are not able to load this link, let me know, please. What exactly the regulation that governs the, did the screen change? So as you see here, that to work as a physiotherapy assistant, some physiotherapy assistant will have received a diploma, and the others may have just got a formal education in the course, and some of the people can be just trained on site. What I mean to say is that, assume that there is somebody who did not go for any course, no physiotherapy studied, no kinesiology, no athletic therapy, nothing, no background of physiotherapy, and I wanted him to work as a physiotherapy assistant with me in my clinic. I just have to bring him, keep him with me for 3 months or 4 months, and I have to train him into the field. And if I am confident that he has got the ability to work as a physiotherapy assistant, he can work as a physiotherapy assistant with me in Canada. So the PTA has got no regulations at all. So anybody with a formal education as a diploma or a physiotherapy, when you step into this country and before getting the license, you all will be in a position to practice physiotherapy assistance post. In fact, in my own clinic, I have 5 people who are working as physiotherapy assistants, who are all the graduates from India and who are all in the process of their licensing for registered physiotherapists. So for the first step when you come here is a physiotherapy assistant position, which you will directly get into it. The second is going to be, there's something called as a resident physiotherapist. That is, I told you that there are going to be 2 components. One is the written component exam, and second one is the practical component of exam. Once you clear the written component of exam, you will be called as a resident physiotherapist. And you have to work under the supervision of a registered physiotherapist like me. But the registered physiotherapist need not be in the location of practice. I can be elsewhere in another city, and you can work in another city as a resident physiotherapist after the clearing the written exam. I'm going to go into those steps also. Very soon I'm going to go into those steps too. So the physiotherapy assistants don't need the license, and the physiotherapists need the license. And once you clear the written component and the clinical component of the physiotherapy competence exam, that is called PCE. Pradeep told it's NPTE, National Physical Therapy Exam, is for United States, and PCE, Physiotherapy Competence Exam, is for Canada. And Physiotherapy Competence Exam has got the 2 components. Now, as a physiotherapist, once you finish your BPT, you want to come to Canada. You have 3 options to do. One is immigrate. The country is open for immigration. United States is closed for immigration. You need a lot of effort to become a citizen of United States. You need to have a green card. Then only you can become a citizen. But here, the government of Canada wants skilled people to migrate to this country. That's how I came 10 years back, 11 years back, on a federal skilled worker visa. So you need to, what do you mean immigrate? So I'll tell you, one is to immigrate. And in immigration, there is something called as an express entry for skilled workers. Like all the physiotherapists, they're all skilled workers. The jobs or the professions are classified. I think Pradeep was mentioning about Schedule A, I guess. Like that, this is called skilled work. The physiotherapy is a skilled work. Professional courses are all skilled work, and you have an express entry against the other professions. Physiotherapy has got an express entry into it. I'll talk about it. You can immigrate in the express entry. And if you not qualified for the express entry because there is a score there, I'll talk about that score, because you need to be very clear about the cutoff scores that are there. Right now, the current cutoff scores for any express entry is 460, as you see it on the screen. And if you are not qualifying for that 460 score, I'll talk about how you are going to get this score also today. Then you can apply even for provincial nominee program. I'll talk about that. And then other ways to come as a student. Now let's go back and see how you can immigrate to Canada. I'm going to just throw a very brief light on it, how to immigrate. As you see that, this is the government website. And here it says that you can come as an immigrant to Canada, and also as a study, on a study permit also you can come. Say if I click on the immigrant, you see that there is an express entry and there is a provincial nominee. There are 2 things here. For this express entry, for you to come to Canada on express entry as a graduate in physiotherapy, what you need to know? You need to have something called as comprehensive ranking system. Now I'll go through that. This comprehensive ranking system is CRS criteria for express entry. This has got certain criteria. Your age is very important. Your level of education is important. Your official language proficiency is important. Canadian work experience is important. Because you are all in India right now, you don't have the Canadian work experience. So you cannot score anything in these 2 categories. Say somebody who is married and he want to come with the spouse. If your wife is educated, you still get some points. Now, is the message clear? Try to get married to people who are more qualified to come to Canada. So just on the lighter aspect of it. Now points without the spouse is here, and the points with a spouse is here. Now the maximum score that I told you for you to enter Canada, right now the cutout is 460 or 470. So how on the age you can have maximum 100 score, level of education 140, official language I told you that, and even the spouse 10, 20 and 30. So the maximum that you can gain here. Now these slides are going to be available after this webinar in the links. So anybody who want to go through this in detail can always come back to this webinar, scroll through the slides, and they'll be able to understand what exactly we are talking about. So I'll just throw a little bit light. Somebody who is 20 years to 29 years, what is the score? 100 out of 100. Somebody who is 30 years of old, 95. 31 years, 90. 32 years, 85. I am 42 years. I have only 25 points right now. So if you are young and you want to come to Canada, come on, start packing your bags, because the sooner that you start applying, the more points you gain in your age. So that is one criteria. So you got 100 points there. I told you that even the level of education, bachelor's degree has got certain score, master's degree has got certain score, doctorate has got certain score. What is that? You need to go through it. The websites are very, very, very clear in the sense that when you, one more suggestion I would like to give you being in Canada is that please don't fall prey for people who are doing these consultancy services. Please have knowledge about the process, because everything is there available on the websites. You need to have patience to go through all these things, and you need to have a thorough knowledge about what is the procedure of coming, because if you have that procedure within yourself, nobody can cheat you. When I came to this country, I was not dependent on anybody. I have processed the entire application myself, and I came in as a skilled worker visa holder and stepped into this country. Without a job, I came to this country and started working as a physiotherapy assistant. For 2.5 years, I worked as a physiotherapy assistant. A lot of questions were posted when Pradeep was handling. What are the salaries that patients are, how much are we going to earn? I'm going to throw a little bit light on that also. So, just to conclude about the express entry, you have age, education and all that. And if from all these 1200 points, if you get 470 points, right now you can apply for immigrating to this country, and the immigration is still open. Even with this pandemic and all that, applications are still accepted. And if somebody is completing their course, and also second thing is that if you scroll down further, there is also experience. So somebody who is just finished, please do not waste your time. If you have finished your course, start getting some kind of experience somewhere. Even if it is a private institution or a private hospital or a private clinic, start your practice and have some kind of certification with you that you have been working as a physiotherapist in so and so, so that if you want to come, I want you to use that particular experience letter in applying to the immigration process to Canada. So that is the express entry that you can come into this country. Provincial nominee, what exactly it means to say is that the express entry is for the entire nation. Assume that your score is not coming to 460 and you are lacking behind by 40 or 50 points. Now you cannot come, because what happens is that only somebody meets the criteria of 460 points will be called invitation. They'll send you invitation that you have fulfilled the criteria, you can come to Canada, and send us your passport to the office for scrutiny and all that. But if you are not able to get the 460 score, what you should do is that, see, the thing is that everybody want to come to Hyderabad or everybody want to go to Bangalore. Everybody want to go to metropolitan cities. Likewise, in Canada also, lot of people want to come to Toronto. Some people want to go to Vancouver, but they don't want to go to periphery. So what the government did is that every province is developed. There's nothing called as underdeveloped. But people who are not choosing to go to certain provinces because of the climatic conditions, or because there were hardly not many people out there, they have eased out the process to come to Canada for certain provinces. And that is the provincial nominee program. So you should be clever enough, if you fall short of certain scores, to get the entry to Canada under the express entry, then you should immediately contact the provincial nominee program. If you type it and you Google it, you get enough information for provincial nominee programs. And then you need to contact the province. Provinces and means states. Like in the United States, there are 50 states that forms the United States of America country. Canada has got 10 provinces. So each province has got different regulatory body, but the exam is common for all of them. So once you clear the PCE, Physiotherapy Competency Exam, which is conducted by the national body, written and clinical component is cleared, now you have your exam clearance certificate. Now you can go to Ontario and apply for license in Ontario. You don't want to work in Ontario, you go to British Columbia, you apply for British Columbia license, and they'll give you the license in British Columbia. So the passing of the exam is national, practice is provincial. Every province has got a regulatory body. I am in Ontario, and my regulatory body is called College of Physiotherapists of Ontario. In British Columbia, it's called College of Physiotherapists of British Columbia. The colleges means regulatory bodies in Canada. So provincial nominee program, you need to apply to the province, and if the province has got less number of people coming because of certain, there are many factors that affects the people coming to. Say somebody, like a lot of people are watching this webinar. Will you be interested to go to one village to work? No, that is the reason. Doctors even, the government gives incentives to the doctors to work in a primary healthcare unit somewhere. And if somebody is wanting to have a government seat in the post-graduation, they put a bar that you need to practice in a village for 2 years. Then only we are going to give you a postgraduate degree in the government institutions. Like that only, the Canada also says that you want to come to our country, come. But you need to be there in those provinces for 2 years. And after the 2 years, you are free to move in the country anywhere. Now, that's about the provincial nominee program. Provincial nominee program, and then coming to study. Now, before I go into the study, I just want to tell you one thing. You are immigration, 460 points, you are okay to come. Provincial nominee, you applied, you are okay to come. What are I'm talking about? I'm talking about immigration. Immigration means you come to this country as a permanent resident directly. You step into this country as a permanent resident, which is equivalent to green card in United States. As a permanent resident of Canada, citizen and permanent resident. The only thing that is not there is permanent residents cannot vote. Citizens can vote. Permanent residents cannot vote. But the permanent resident can do anything. I can work in a salon. I can work in a coffee shop. I can work anywhere. Any skill that I have after you have immigrated as a express entry skilled worker, there is nothing like you have to work only in physiotherapy. When you come in a provincial nominee, there is nothing like you have to work. So I stepped into 300 physiotherapy clinics and gave my resume, and I did not get a job. I'll talk to you about that a little later. So, I have to survive. So I can take up any job. So there is no bars on the jobs that you can do when you come to this country as an immigrant on the express entry or on the provincial nominee. But if you are coming as a student, so now you did not qualify for this 460. Provincial nominee you have applied, you did not. Because you are just finishing your BPT, you want to pack your bags and come to Canada. You don't have that 460 score because your funds, how much is your earnings also, there is a criteria. I did not go through all that criteria, scores and all that because the time will not be sufficient. I want you all to go through that. All of you will not be eligible 460 as a bachelor's of physiotherapy 4.5 years. After completion, you will not be qualified for 460 marks. So you have to work for 1 year or 2 years to make up that score. Somebody is not willing to wait for 2 years. You want to come here? Come on a study permit. So there are two kinds of study scenarios in Canada. One is called university education. The other one is called college education. College education means most of the diploma programs, 4-semester programs, 3-semester programs. I'll show you what exactly those college education means. And university education means all the professional courses are under the university. Now, people who are watching this webinar, I want you to understand one thing. Physiotherapy in Canada is offered after 4 years of bachelor's degree in health sciences. What do you mean by that? In India, after the 12th grade, you can join BPT college or physiotherapy course. But in Canada, you cannot. If you want to do physiotherapy course in Canada, you need to clear your 12th grade or 12th class. And then you need to go to the university for 4 years. And you do your Bachelor of Sciences or Bachelor of Kinesiology, Bachelor of Health Sciences, something to do with the health aspect. You need to do 4 years course. To get into the university itself, you need to have 90, 92, 94 percentile in your 12th grade, then only you get into the university, because there are only 14 universities that offer professional courses in the entire country. There are only 14 universities that offer physiotherapy courses in the entire country. So getting into university is a challenge in Canada. So what the Indian students do is they will take out that university option because it's very expensive, very, very expensive. And you need to be on the top of everybody to get into admission into any of the universities in Canada. And not knowingly, when I came here, where they asked me, where did you do your physiotherapy from? I said, Kasturba Medical College. Hey, you studied from a college? Because college means it's a diploma and, all those small courses run under the colleges. So we need to tell these people, I'm a graduate from Manipal University. Then they'll look, oh, he's a university graduate, not a college graduate. But in India, colleges are the institutions that offer, like Yashoda College of Physiotherapy. College is institution. So I just want you to be aware of it. If somebody want to come to Canada, you need to understand the terminology that they use for college is all the diploma and lower courses. And for the university is professional courses like ours, like professional MBBS, BDS, physiotherapy, law, Bachelor of Business Management, BB, all of them are professional courses which only the universities run. Now, what are these colleges? Colleges means community colleges. Example, I'll show you. There's a college called Humber College. This is called Humber College. Humber College, if you go to health and wellness courses, and if you click the health and wellness courses, lot of courses will pop out. Biotechnology course, which is a 4-semester course. Clinical research, 3 semesters. So I know a lot of people come for a related course called as fitness and health promotion, which is a 4-semester course. So a lot of people who are doing PPT, they will apply to this Humber College or any of the community colleges, fitness and health promotion, physiotherapy related. So they opt these related courses. Somebody even take a massage therapy course. There's nothing wrong in that because you just want an entry into Canada. That is the reason why you are doing these courses. So you take these courses and then you come as a student to this country. And now let me take an example of fitness and health promotion. How many course? It's a four semester course. Each semester is 6 months. So it's a 2 years program. So what happens when somebody comes to Canada on a study purpose, taking this fitness and health promotion? Let's see that. He comes for 4 semesters. I told you it's 2 years. The moment you finish your 2 years course, you get a 3 years work permit. Fantastic. So the moment you come here, you apply for 2 years course. After the completion, you get 3 years work permit. That means he is in Canada for 5 years. Correct eligibility time to get married by then, because you are in Canada. Nice alliances will come because you are in Canada. Now, when you have these 4 semesters, as I told you that each semester is 6 months, but the course is actually only 4 months duration. 2 months you'll get a break. So when I say that semester is equal to 4 months with a 2 months break, you can work 20 hours per week while you are a student for that 4 months. You can work 20 hours and you can work 40 hours per week during the 2 months of the break time. What you can work? You need not work as an assistant physiotherapist. If there is a coffee shop and if there is a job, you can do that job. University campus itself will have lots of jobs in the canteen jobs, the coffee shop jobs, or if you go out into a departmental store like Walmart jobs, lots of jobs are there available that you can get into it, and these jobs will pay you good. You will be able to make up all the money that you need to pay for the course fees during the time that you are in Canada. And so community colleges, 4 semesters, 2 years, you get 3 years of work permit. If you opt for a 2-semester course, there are some 2-semester courses also. 2-semester course means it's a 1 year course only. If you do 1 year course, you will get 1 year work permit. If you do 2 years course, you get 3 years work permit. So now the work permit is only 1 year. So a lot of people come for the 4-semester courses. And once you finish with this, what happens next? When you do 2 years of study and complete 1 year of work permit, you become eligible for applying as a permanent resident. Once you are a permanent resident, nobody can pull you out of the country. You are a permanent resident of the country. You have all the rights as that of a citizen. So if somebody is not able to get into the country by the express entry or the provincial nominee, the best way to come to this country is by opting as a student. And once a person is applied for the PR, after the 2 years of study and 1 year of work permit, and if you stay in this country for 3 more years, then you become eligible to apply a citizenship and you become a citizen. So today I am a citizen of Canada right now. So study, now what happens is that somebody does a 2 years course and 1 year of 3 years of work permit. Now study plus work permit, they'll consider it as 1 year. I told you that you need to be here 3 years of PR. When you finish 2 years of study and complete 1 year of work permit, you become eligible for PR. But after becoming PR, you need to be there for 3 years to become eligible. But when you want to become a citizen, they will consider your study period also and work permit period also as 1 year in these 3 years. That means after your study and work permit, if you stay in the country for only 2 years, if you are a student and work permit and you stay for 2 years, then you become a citizen of this country. And as a citizen of country, you enjoy a lot of benefits. One of the biggest benefit of Canada, the entire health is free. What do you mean by that? Entire health means somebody 50 years old, he has a total knee replacement. The total knee replacement surgery is completely free. Somebody has got a problem with the lungs. They want to go and take an X-ray. X-rays are free. Ultrasound scans are free. MRI is, bypass surgery is free. Its health care is completely taken care by the government. And also, your education up to the 12th grade is free. No schooling fees for 12 years, up to 12 years. From the grade 1 or class 1 to 12th class, no school fees. Books are provided, everything, education is free, your health is free. So that's the biggest advantage of this country, because that is the reason a lot of people come here. Now, having said that, did I make myself clear how you can enter into the Canada? Now, you have entered the Canada now, and you want to now become a physiotherapist. What you should do? To become a physiotherapist, if you are currently enrolled or if you are a graduate from any of the universities outside Canada, you are called an internationally educated physiotherapist. So all of you who are in this webinar, if anybody is not from Canada, they're all internationally educated people. Even a Canadian citizen, assume that tomorrow I want to send my son to Manipal University or Yashoda institutions to do physiotherapy. When my son returns, he'll be an internationally educated student, and he's not going to be a Canadian student because he studied outside. Now, here comes what Pradeep also told, we need to get the credential evaluation done. So anybody who is already come here, student permit or express entry, after that completion, now you need to apply for Alliance of Physiotherapy Regulators is a national body. The national, like FSBPT. Now it will do a credential evaluation. It will compare course by course, what you studied in Yashoda, what you studied in Srinivas College of Physiotherapy, what you studied in Zamia in Delhi. Physiotherapy course is compared to Canadian physiotherapy, and they will find out whether it is equivalent or not. If there is no equivalency, they will give you additional courses. Those are called bridge programs. Say now research methodology is not in the curriculum of some of the people who are in the webinar. Don't worry about it. Research methodology, they'll give you as an online course for 6 weeks, and then you clear that online education, and then you apply again, and they'll add to your credentials whatever they have got from the university, and they'll declare you that now you are equivalent to the Canadian educated physiotherapist. Now you go for your exam. So the Alliance of Physiotherapy Regulators evaluate the entire courses which are there in the world. So it is like an agency that completely evaluates the people's certifications and all that. Now, having said that, we are now talking about India. What happens when an Indian physiotherapist applies to Canada? Everybody will be very curious to know this. What is the country profile? Let's see that. This is going to be a little disheartening, my friends. Don't get disappointed. We need to select the country. Let's select India. Let's select India and see what exactly it has. Registration is required to practice in Canada, yes. But in India, we have only certain states now regulating our profession. You're all aware of it. It's not regulated at a country level. Now, the direct access to the patients is there. Now, this is the data that Canada has about India. So they all know, do we assess patients and clients? Yes. In Canada, we do assess it. In India also, we do it. So look at this India. Yes, 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 yes. Yes, 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 yes. We are almost equivalent, except for one thing, that our profession is not regulated yet because we don't have a council in India. I hope and wish that we get some regulatory body in India so that the courses are going to be much more streamlined, like any other professional course like MBBS or the Medical Council of India and all that. We should have a council. I hope we should have that. Let's all pray for that. Now, coming to the physiotherapy competency exam from 2013 to 2017, please don't get discouraged here. The pass percentage of the Indian educated physiotherapists when they come to Canada is only 41%. 100 people come, 41 only clear. If 100 people are giving practical exam, only 47% of them are clearing. I really do not know, because all my staff who are there working with me are also attending this webinar right now. Though it is night 1:30 for us in Canada. I'm sure that Pradeep also is in the same time zone as me. 1:30 in the night, guys, we are still awake. You know why? For the profession, we are all awake. We are all awakening in the midnight. So we are all the rising sons of the midnight. And we should show this to the world that we can rise and shine. I'm sure that we'll be able to do that one day. Now, one person who was working with me, he failed the physiotherapy exam 3 times. You can appear for the physiotherapy competency exam in Canada only 3 times. First time fail, second time fail, third time fail. You are failed for the lifetime. You cannot become a physiotherapist in Canada if you failed your exam in 3 attempts. Please listen this, all the participants. You need to have good skills before you come here. Otherwise, you don't have multiple choices to appear for the exam. I really don't know about how many chances are there. Pradeep may throw a light at a later time. Once I finish with my presentation, if we can mark that and answer that query to all the participants, Pradeep, please. So 40, now what the other person did is that the one who is a physiotherapist, he failed 3 times. He joined for massage therapy course or alternate course, and he's still working with me in my clinic. So your options are not going to end if you fail in your physiotherapy competence exam, because there's a lot more that you can do even when you come here as a permanent resident. So having said that, if you just scroll down, you see all the institutions here: Acharya Institute, Adesha Institute, Manipal Institute. They have information about every institution from India, whether the courses are equivalent or not. All these are already there in Canada. So opting your career into one of the recognized institutions is very, very important. Which institutions are recognized by the Canadian Alliance of Physiotherapy Regulators? You can go into this particular website to see. These green marks shows that they're almost their university education in entry-level physiotherapy and the clinical practice, they match with the Canadian degrees. So they clearly have given each institution's name here, and here there are some insufficient data. That means they are not very clear about BS College of Physiotherapy in Tamil Nadu and all that, but most of the colleges, it's a green, 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 green. So having said that, I just want you to show, once you have the credentialing clearance, credential is over, now you go for your physiotherapy competency exam. That is the PC, written component and practical component. Now, how does that work? I just want to show you that before I conclude. It's just going to take about less than 10 seconds to load, but I'm sure that every one of you will understand, or will just at least have one kind of a journey into it.
Physiotherapy competency exam has 2 parts. Part 1 is the qualifying examination. This is the written component. Part 2, the physiotherapy national exam, is the clinical component. Candidates must pass Part 1 before advancing to Part 2. Part 1, the written component, consists of 200 multiple-choice scenario-based questions, which are administered in a 4-hour session. The questions measure general physiotherapy knowledge in the biological sciences, the social sciences, applied science, scientific inquiry, clinical science, and professional practice. Part 2, the clinical component, is a performance exam. It assesses the candidate's ability to interact effectively with the client at each of 16 different clinical stations. At the clinical stations, what we call standardized clients are used to simulate real clients. These are healthy people who have been trained to present signs and symptoms consistently and realistically. Candidates should treat the encounter with the standardized client just as they would treat a real-life clinical encounter with a real client.
Just to conclude, there are going to be 200 questions in the written component, and you need to clear that exam. And secondly, you have 16 clinical stations like these. She was assessing his knee. So it is the assessment of the knee. On the next room, they'll ask you to assess the range of motion of the shoulder. In the next station, they'll ask you to auscultate. Out of the 16 stations, you need to clear at least 14 stations to be a registered physiotherapist. And if you clear 14 stations or 13 stations, depending upon how exactly the overall performance of the candidates, the station passing score is determined. It may be 12 sometimes, it may be 13 sometimes, it may be 14 sometimes. And once you clear this, then you are through. You get through that particular thing, and then you will be a physiotherapist in Canada. Any questions now?
The talk was so clear that I don't have a single question in the chat box here. I think you have readily given all the info what they were anticipating, and
No, but if you don't see any questions there, are the participants still there? I'm so happy about it. I'm so happy about it. Good to know.
So one query from our personal front, heading the institutions. We have
Please.
many parents questioning us in terms of gender bias. Many of the parents are apprehensive in joining the girls for PT career. So we would like to have your message addressing that statement.
Fantastic. As I just told you that I took you as an example, Monima. Okay, I'll ask you a simple question on the same note that, do you have any children, Monima?
I have one daughter, sir.
What did you do when your daughter was born? You took leave?
I was on leave for 2.5 months, sir.
There you go.
Yeah.
You had the provision of taking leave when you needed and you came back into the profession, right?
Yes, sir.
Okay, what if your husband gets a transfer to one of the smallest remote village in Tadepalligudam, close to that? What will you do? You will go with your husband, right?
Yes, sir.
But still you will be able to practice in that small village as a physiotherapist. Am I right?
Yes, sir.
So that means to say that you will never be devoid of a job. So wherever you are, whichever the part of the country that you are, you will be in a position to practice you can at home, your husband is gone to work, your child is gone to school. In your own home, in the front room, you can start practicing as a physiotherapist. Am I wrong? Definitely, this is the best course for any female to get into this particular. This message is for all the parents who are watching this webinar. I have no business to say this, because I'm not a marketing person for any of the private organizations, but the thing is that without any second thought, you can join your daughters into this course. There is no doubt about that.
And sir, can you add on the entrepreneurship in Canada? Like, what will be the prerequisites once they clear their licensing?
Once they clear their licensing, what are the prerequisites means? Once they clear their license,
yes, sir,
they can opt for jobs.
Yes.
So, like physiotherapy clinics are there. Multiple physiotherapy clinics are there, and long-term cares are there. Long-term care means old age homes. Okay, Canada has got a lot of population of old people. So they call it as LTC, long-term care units. 70% of the physiotherapists work in long-term care units. 70% of the physiotherapists work in LTCs, long-term care. And about 20% of them work in the hospitals. 10% of the people are working in the community with the physiotherapy clinics. So long-term care unit with old age people, you can apply and you can get your jobs. Hospitals, you can get your jobs. And if, like me, I did not go to LTC, long-term care, probably because I just wanted a challenging career. So I wanted to start with a private institution. So what I did is that I worked for a private clinic where they needed a chiropractor who does manipulations. A medical doctor was there, and I joined as a physiotherapist in the team. And after 2 years of working with them, I understood how the entire system works. And then what I did is that I came out and I started this clinic. This is my own clinic.
Yes.
And I'm now the employer, and I have about 7 to 8 people. There are chiropractors who are working for me. There are massage therapists who are working for me. There are physiotherapy assistants who are working for me. So you can establish your own clinic with, how by then, if you have worked for 2 years in private clinic, you'll have $30,000 or $20,000 Canadian dollars, which is very easy for us to set up the private practice in Canada. $20,000 is enough to start a practice. Just before we go, some of the questions that were there on that is that how much you are going to make as an assistant physiotherapist. See, the thing is that, as I told you, that if you work even as part-time work for 20 hours and 40 hours and all that, you'll be able to make up your entire course fees. Generally, the basic wage right now in Canada is $14 per hour. That is the basic wage. no employer can pay you less than $14 per hour. So now, as a physiotherapy assistant, generally, it all depends upon the employer. If you really have, you do good job for them, they pay you $16 per hour, $17 per hour. And if you are a bachelor or if you are a single person, if you are working for 8 hours and you are making $150 per day, and over a period of 20 days, 25 days, you make $3,000 per month, close to $3,000. Or $3,000 means 1,55,000 Indian rupee as an assistant physiotherapist. And as a registered physiotherapist, your salary, resident physiotherapist, I mentioned to you about a resident physiotherapy comes in the middle after the written component, you make $35 per hour. And as a registered physiotherapist, you make $45 per hour. So when I was working for another doctor in a clinic, I was making $45 per hour. I still see around 500 participants in this webinar. And I just want to tell one thing. Assume that you have a clinic like this and you are seeing 20 patients from morning to evening. And each patient pays $60 for the service fee. 20 patients into $60 is $1,200 per day is a revenue when you have your own clinic. $1,000 a day in Canada. I don't think so anybody can back on that. It's a very, very lucrative thing. Guys, if you are really serious about your profession, nothing can stop you from getting anywhere. Even United States also will be open for you. Canada also will be open for you. But my humble request to each one who is watching this seminar, please work hard on the basics. On the basics. There are so many people. Rajesh sir is there, Suman sir is there, Maunima madam is there, Manasa is there. So many people are there who are there to guide you. Very heavy heart. I'll tell you one thing. We are here, but our heart is there. If our heart is not there with you guys, we would have been not awake at 2 o'clock in the midnight. Because our struggle, even here, we want to help you guys. Maunima madam and Suman sir will have our contact details. Shoot emails if you have any questions and all that. I'm sure that even Pradeep is going to watch for that. And if you have anything, we'll always be there to help you out in clarifying your queries. Even after this webinar is just a beginning, of the relation with you guys. And this is going to go a long way. Maunima, if you have any other questions, please.
So is it wise to plan BPT by moving to Canada? If so, what would be the expenses and how do we go about it? There are people who are putting on the questions in those lines.
No. It's not wise to come to Canada to do your BPT. Why? Because if you come to Canada after your 12th grade, you need to do 4 years of your Bachelor of Sciences.
Yes.
4 years Bachelor of Sciences in a university. And I told you that from the grade 1 to grade 12 or class 1 to class 12, no fees, right? From the university, 4 years, government will take everything, whatever you haven't paid in 4 years. So the university course fees is very, very high. It's not affordable. So it's not advisable for you to come to Canada for doing BPT. After your bachelor's only, you know what? Nice institutions are there. Join, finish up your course, and after the BPT, plan. And if you want to go to United States, think of even MPT. And if the things are, by the time you finish, it's going to be a mandated doctorate in physical therapy is becoming mandate United States, entry level only. Pradeep knows it. Even every one of us have to. All the people who are already practicing physiotherapists, who have finished their bachelors, who have finished their masters, my humble suggestion is, including me, we all need to move forward to do our doctorates for a better future for all of us. So people who have not done your doctorates, please move forward to your doctorate so that even if you really want to have a step forward to go to United States, there should not be any barricade there. Stop. No, you did only MPT. Don't come. No. And opportunity, Pradeep said opportunities, lot of opportunities there in United States, lots of opportunities are in Canada, but India is not less. Opportunities means for courses, every opportunity is there for you to do in India with less fees and all that. So all foundation you make there, construct the buildings on the foundation after coming here.
So I think we are done with all the questions now. So, and I think you have covered you read all the minds of the participants, and you have covered up in your talk wherein we don't have any questions on the chat box also. So thank you so much, sir, for your valuable inputs and advice. We are greatly indebted for readily accepting our request. We have with us Dr. Chandrasekhar, sir, who is gravity of our institution. Sir constantly and closely monitors and supports all the initiatives taken for physical therapy education with, as far as Yashoda is concerned. So now I request our Dean, sir, Dr. Chandrasekhar Garu, to propose vote of thanks.
And the students of their mother country. Dr. Pradeep has really given the wonderful vertical information that how one can pursue the physiotherapy career further in United States of America. And I'm sure that his talk has enlightened the masses here. And there are 600 participants, and everyone have got some good vertical information about this one. And we are very happy. Dr. Pradeep, we are really very happy, and a big thanks to you for taking a lot of interest, you can see, to cover the beautiful points, you can see, to enlighten the students of India. That's how to proceed further, you can see, for the better career in the United States of America. And he's also mentioned about the communication skills, and people have to get ready with the TOEFL exam and the GR exam. We're on the job here at Yashoda. Always we are on the job, you can see, to develop the communication skills, because the most of our students are from the rural backgrounds and the villages there. So therefore, a special focus has been what the kept, you can say, to develop the communication skills. And I'm sure that for a period of time, our students will definitely develop the communication skills up to our expectations, you can see, to take part, to come to US and then make their career or to build their career in the fact here. Then coming to Dr. Sunil Kumar, the chief physiotherapist, the Mississauga Physiotherapy Clinic, Canada. Dr. Sunil, you're really wonderful. I'm telling you that you have we are really excited, you can see, to listen to your talk. And almost 1.5 hours you spent your valuable time at the midnight, and that very clearly shows that how much love you have got towards our mother country. And we are very grateful to have you as a speaker for this wonderful international webinar organized by Yashoda College of Physiotherapy. Dr. Sunil said that he's throwing some light on us, but he has not thrown the sunlight. He has thrown a sunlight on us. He has thrown a sunlight on us, and that is a very big light, you can see, for the students of this country, and also for the aspiring students, and for the the pursuing students, and also for the practicing the physiotherapists here. His talk is really, really very much useful here. And I'm sure, and I'm feeling myself that no, I would have been in Canada if there was a Sunil for me 30 years back, and as it was not there, I missed that chance, what I feel personally. And I'm sure that because of its talk, the 50% of the today's participants will definitely plan to fly to either to USA or to Canada with their inspirational talks. And Sunil is a very good motivator here, and really he has enlightened all of us there, you can see, about the not only opportunities about the the physiotherapy PT opportunities in Canada, and he has given the beautiful geography of the Canada also, that how and one can plan to go to which part of Canada and all that he has mentioned here. And exactly a very good into information which the present students are required, you can see, who are studying and pursuing their career in physiotherapy in India. He has given a beautiful picture that how can they make their career, how can they build their career in Canada. So thank you, Sunil. Thank you so much. And a ton of thanks to you for sparing your valuable time at midnight, the 2 o'clock in Canada, according to Kenyan time. And we also thank profoundly Dr. Srinivas Garu, DM Cardiology from Warangal. As Mr. Sunil was mentioning that Dr. Srinivas was on the line, you can see on this platform here to listen to this program. We really feel very proud, can see, to have you on this platform here, and your participation in this program will definitely adds color, you can see, to this webinar here. And doctors like this will coming forward to encourage the student community that always goes in a very big way to develop the academics in our country and to create a kind of the awareness among the mindset of the students of this country. Then I thank my dynamic physios. I always call them the dynamic physios, Dr. Suman and Dr. Monima, Dr. Manasa, Dr. Rajesh Reddy. All is my team here. And but for them, it would have been possible for me to develop the two beautiful physiotherapy colleges at Hyderabad city by the support of the management of Yashoda hospitals here. And I'm sure that within the gap of 3 years, we could able to build two physiotherapy colleges in Hyderabad city. And it's all because of the strong efforts put by all this, the 4 members, the dynamic physio team of Yashoda hospitals here. But this all is done by the support of the Yashoda management, by the support of our executive director, madam, by the support of our managing director, madam, and also Dr. Lingay sir, who is always there consistently behind, as you can see, to support, to build a beautiful education institutions which can really bring up the students with skill and as well as the knowledge so that they can face any kind of challenges in the world which are going to come up in their life. So this is what exactly the team has done for the last 1 week. This team, wonderful job they have done here. And not only these people there, all our physiotherapy faculty members in the college and as well as in the hospital, they have taken a lot of care in organizing this international webinar. So I thank all of them, can see, for doing this excellent job. And I'm also looking forward to have this kind of seminars even in future too. And at the end, a big thanks to all the participants. Almost 600 participants have taken part in this international webinar, which is not a small task here. Because the team has taken a lot of efforts, you can see, for the last 1 week of time. And their efforts have resulted in a very big way of having the 604 on this webinar platform for this international webinar here now. So thanks to one and all. And I'm sure that this is really going to make a big change in the mindset of all the students, and we can plan and for their better career. And I'm sure that we will definitely take the help of Mr. Sunil and also Mr. Pradeep in the future too, in guiding our students and also in giving some inputs, you can see, for Yashoda hospitals and to our dynamic physiotherapy teams here, so that we can also train the students on our expectations here, and we can give them the strong foundation, and we can send them to US and Canada so that we can also guide them further for the beautiful career. What you're enjoying there, let them also enjoy the same thing. This is what exactly is our intention and our wish, and for that purpose only, we thought of organizing this seminar here today. So we are really very, very happy to have you on this platform. Once again, I thank one and all for taking part in this program here, and I also thank the organizers for giving me this opportunity to propose the vote of thanks at this seminar, at this platform here now. Thank you all. God bless you all.
Thank you, sir.
Thank you so much, sir. I hope this session has been worthwhile, motivating, inspiring, and guiding all the aspiring young physiotherapists. I am sure this session is a fruitful one to all the participants. Stay tuned. We will be back with 2 more iconic PT personalities from 2 other countries very soon. Just as a colorful kites fly away, though we have the ends of the kites stranded to the motherland. With these 2 lines, I end today's session. सारे जहां से अच्छा हम बुलबुले हैं इसकी ये गुल सिता हमारा. Thank you one and all. We wish a big strength and a grand number again in our next webinar. And to leave a hint, it would be 2 personalities from UK and Australia. Thank you so much for the support. Thank you one and all.